If you have an L4-L5 disc bulge, you're probably not worried about your back. You're worried about the burning pain shooting down your leg and whether it's ever going to stop. But what if the missing piece calming your sciatica isn't another stretch, injection, or traditional physical therapy machine? In this video, I'll show you a research-backed technology that's changing how we treat sciatica from an L4-L5 disc bulge and how it helps people avoid surgery, recover faster while naturally reducing pain and inflammation. I'm Dr. Cordova. I've been a chiropractor for over 29 years, located here in Houston, Texas. I've helped thousands of patients with disc bulges, sciatica, and leg pain get their life back without surgery. The technology I'm referring to is PEMF, which stands for Pulsed Electromagnetic Field Therapy. In this video, I'll explain exactly how we use PEMF to help reduce sciatica pain caused by an L4-L5 disc bulge, why it can help calm an irritated nerve, and what you can realistically expect if you're considering this treatment. I'll also answer the 5 questions patients ask me most often, including the biggest one: will PEMF actually stop my sharp leg pain and sciatica? Keep watching, but before we get into that, it's important to understand what PEMF actually is, how it works inside the body, and what the research says about using it for pain, inflammation, and healing. Once you understand that foundation, the answers to those 5 questions will make a lot more sense. PEMF stands for Pulsed Electromagnetic Field Therapy. It's a completely non-invasive treatment that uses carefully controlled magnetic pulses to interact with the body's tissues. Unlike electrical stimulation, there are no needles, no surgery, and no painful electrical shocks. Researchers believe these pulsed magnetic fields influence how cells function. Laboratory studies suggest they may help cells produce energy more efficiently, improve communication between cells, and support the body's normal response to inflammation. Those effects may create an environment that supports healing. When it comes to low back pain and sciatica, the research is encouraging, but it's also important to be realistic. Several clinical studies have found that PEMF can reduce pain and improve physical function in some patients, particularly when it's used as part of a comprehensive treatment plan rather than as a standalone treatment. A randomized controlled trial involving patients with lumbar disc-related nerve pain found improvements in pain, disability, and nerve function after a course of PEMF therapy compared with the placebo treatment. That doesn't mean PEMF magically pushes a bulging disc back into place. It doesn't. What it may do is help calm the irritated tissues around the affected nerve, creating a better environment for your body to heal while making it easier to move, exercise, and continue the treatments that address the underlying problem. And that brings us to the first question. Will PEMF actually stop that sharp leg pain and sciatica? This is by far the most common question I hear from patients with an L4-L5 disc bulge, and it makes sense. Most people aren't nearly as concerned about the ache in their lower back as they are about the burning, shooting pain that travels down the buttock, into the leg, and sometimes all the way to the foot. That nerve pain can make it difficult to sit, drive, walk, or even get a good night's sleep. To understand how PEMF may help, it's important to understand what's causing your symptoms. In many cases, an L4-L5 disc bulge can irritate or compress the L5 nerve root. When that nerve becomes irritated, it's not just being squeezed, it's also becoming chemically inflamed, making it much more sensitive. That's why even small movements can trigger sharp electric-like pain down your leg, and PEMF doesn't physically push the disc back into place, and it isn't a treatment for every case of sciatica. What it may do is help calm the irritated tissues surrounding the nerve. Research suggests that pulsed electromagnetic fields can influence the cellular activity and the body's normal inflammatory response, creating an environment that may help reduce pain and support recovery. Clinical studies have also shown improvements in pain and function in people with lumbar disc-related nerve pain who receive PEMF as a part of their conservative treatment. In my practice, we don't use PEMF by itself. We use it as one part of a comprehensive treatment plan designed to reduce nerve irritation, improve healing, and help patients tolerate movement and rehabilitation much sooner. As the irritation around the nerve settles down, many patients notice the sharp pain becomes less intense, travels a shorter distance down the leg, or occurs less frequently. Those are encouraging signs that the nerve is becoming less sensitive. Of course, one of the next questions people ask is, what does PEMF treatment actually feel like? So let's talk about exactly what you can expect during a PEMF session. The good news is that PEMF is completely non-invasive and painless. During your treatment, you'll remain fully clothed while a specialized applicator is positioned over your lower back. Unlike a TENS unit, PEMF doesn't send electrical current through your body, so you won't experience any stinging, shocking, or muscle contractions. Most patients either feel nothing at all or notice a gentle pulsing, tapping, or rhythmic sensation around the lower back. Many describe the treatment as relaxing, some even fall asleep during the session. Because nothing is physically pushing, twisting, or stretching your spine, the treatment is generally well tolerated even during an acute flare-up of sciatica. Each session typically lasts about 20 minutes. The goal isn't to force immediate change, but to create an environment that supports healing while helping calm the irritated nerve. That's why many patients are surprised at how comfortable the experience experience is. But comfort is only part of the story. The next question is the one that really matters to patients. Can PEMF actually help heal an L4-L5 disc bulge, or is it simply helping manage the symptoms? The truth is, PEMF doesn't physically push a bulging disc back into place. If someone tells you it does, they're overstating what the technology can do. Disc tissue heals gradually through your body's own repair processes, and unfortunately, the discs in your spine have a very limited blood supply. That's one reason why disc injuries often take longer to recover than muscle injuries. Research suggests that pulsed electromagnetic fields can stimulate cellular activity, improve production of ATP, which is the energy every cell needs to function and support the body's normal healing response. Laboratory studies have also shown that PEMF may help create a healthier environment for tissue repair by supporting circulation and helping regulate inflammation at a cellular level. Think of it this way, PEMF doesn't rebuild the disc for you. Instead, it helps create better conditions for your body to do the rebuilding itself. When it's combined with treatments like spinal decompression, targeted rehabilitation exercises, and activity modification, it may help the healing process become more efficient while reducing the nerve irritation that's driving the symptoms. That naturally leads to the next question patients ask: how long does this process take before you can comfortably sit, stand, or walk again? If you're struggling to sit through a workday, drive for more than a few minutes, or walk around the grocery store without your leg pain flaring up, you want to know when you can expect to feel better. There's no single timeline that fits everyone. Your recovery depends on several factors, including the size of the disc bulge, how irritated the nerve is, and how long you've had the symptoms, and whether you're following a comprehensive treatment plan. That said, there are some common patterns. Some patients notice a decrease in pain or muscle tightness after just 1 to 3 treatments. For others, the changes are more gradual. In my experience, the most meaningful improvements in nerve pain, walking tolerance, and sitting comfort often occur after 6 to 12 treatments performed consistently over several weeks. It's also important to understand that recovery isn't always a straight line. Some days will feel better than others, especially early on. What we're looking for is steady progress. Maybe you're sitting longer before the pain starts. Maybe you're walking further before you need to stop. Those small improvements often build into significant changes over time. That leads to one final question, especially for patients who are already receiving spinal decompression, chiropractic, or physical therapy. If you're already doing those treatments, why would you need PEMF too? This is a question I hear quite often, and the answer comes down to one important principle. No single treatment addresses every part of the problem. That's why in my clinic we use a multimodal treatment approach. Depending on your examination and diagnosis, your treatment plan may include chiropractic structural corrections, non-surgical spinal decompression, rehabilitation exercises, and PEMF therapy. Each one has a specific purpose, and together they work towards the same goal: helping you recover as quickly and completely as possible. Chiropractic structural corrections help restore normal movement and function to the spine. Non-surgical spinal decompression helps reduce pressure on the injured disc and affected nerve root. Rehabilitation exercises improve strength, stability, and movement patterns so your spine is better supported as it heals. PEMF focuses on the biological side of the recovery. While the other treatments address the mechanical problems, PEMF is used to help calm the irritated tissues around the nerve, support your body's normal healing response, and create a healthier cellular environment for recovery. When the nerve becomes less irritated, patients are often able to tolerate decompression, chiropractic care, and rehabilitation exercises more comfortably and make better progress throughout their treatment plan. Rather than thinking of PEMF as an add-on, think of it as a treatment that helps the rest of your care work more effectively. That's why we combine these therapies instead of relying on just one. In this video, we covered the 5 most common questions I hear about PEMF therapy for an L4-L5 disc bulge with sciatica. We talked about how PEMF may help calm an irritated nerve, what a treatment actually feels like, whether it can help support disc healing, and what kind of recovery timeline you can realistically expect, and why we combine PEMF with chiropractic structural corrections, non-surgical spinal decompression, and rehabilitation exercise. Hopefully, you now have a much better understanding of how this technology fits into a comprehensive, non-surgical treatment plan for relieving sciatica and helping you get back to doing the things you enjoy. Now, I'd love to hear from you. Which part of today's video helped you the most? Was it learning how PEMF helps calm an irritated nerve, or understanding why we combine PEMF with spinal decompression and rehabilitation? Drop a comment below and let me know. If you found value in this video, please give it a like and share it with someone dealing with sciatica from a disc bulge. Doing that helps more people discover practical, non-surgical treatment options that may help them move better and feel better. And remember to subscribe to my channel if you want practical, evidence-informed videos on chronic lower back pain, sciatica, disc herniation, lumbar spinal stenosis, and the exercises and treatment strategies we use to help patients feel and function better. The next video you should watch is this one right here, where I show you the 5-step process we use in our clinic to treat sciatica leg pain and help patients achieve fast, lasting relief. Go watch this video next.